Hello viewers, welcome to ANDROCARE Connect program. This week's questions. First question is, hello sir, I have examined LH, FSH, testosterone, prolactin, estrogen. I am a non-vegetarian, not tested B12. Okay, prolactin level is 37. I have ED, low libido, I have confused. Yes. Recently I am suffering from anus pain, and can prostate infection cause ED? So I can see now, prostate infection can cause erectile dysfunction, but you don't need a CT scan to check for prostate infection. Just a basic transrectal ultrasound and semen culture is enough to check whether you have prostate infection or not. So one is transrectal ultrasound and second one is prostate infection. Then second, how long the effects of shockwave therapy will last for venous leakage? Around 3 to 4 years. But if your venous leakage is very severe, then sometimes it may not work. Then you have to think of penile implant surgery. So, but before going for penile implant, it's better to try whether it works or not. Next, third question, Mr. John. I am facing premature ejaculation, which is within 10 seconds after insertion. It's happening same for second round. Okay, my age is, so that means, see, even if second time it is less than 10 seconds, that this is severe premature ejaculation. So now you have to basically do a prolactin test, testosterone, transrectal ultrasound and semen culture, and based on these tests we can find out what is happening. So even though you are not planning to marry, you said you are not planning to marry, that is why you are not consulting a doctor. See, this is a serious issue. So whether you are planning for marriage or not, that is a secondary issue. Since it is only less than 10 seconds, first try to clear your problem. So otherwise what happens, it will lead to performance anxiety. Always you will be worried about your performance. So try to get it solved and then you can wait for your marriage. And one more patient, sir, I am having ED peronis. Okay. I am a diabetic, HbA1c is 8.1. HbA1c 8.1 is very high. I think you have to seriously control your sugar levels. Your HbA1c, your target should be around 6.5. So 8.1 is like uncontrolled diabetes. Your age is 55 years, suggest any penile implant. See, when HbA1c is 8.1, even planning for penile implant is not a good thing. The major problem with penile implant is infection. So, if diabetes is not under control, then there is no point in doing penile implant surgery. First, try to control your diabetes. Once your diabetes is under control, then you can plan for penile implant surgery. At least during that time, at least first 1 month of penile implant surgery, your sugar should be under control. So you have to talk to your dietitian. You have to start little high dose medications. If you control for the first 1 month, then the healing part of penile implant will be done. So you first control your HbA1c, diabetes, and then come for penile implant surgery. Next question, sir, what is the success rate of chronic prostatitis? What is next step if shockwave therapy and antibiotics don't work? See, unfortunately for chronic prostatitis, if shockwave therapy is not working and antibiotics are also not working, then it's difficult. Right now we don't have any options apart from taking long term low dose antibiotics and anti-inflammatory medications. We don't have any other option. So as per present treatment, shockwave therapy is the last option. And why the effects? One more question regarding shockwave therapy. Why the effects goes back to zero within a year? Does it mean we have to take this for rest of the lifetime? See, normally what happens, when penile blood vessels are getting damaged, there should be some underlying cause. So I think in my erectile dysfunction video, I explained what might be the cause for penile vascular damage. It can be diabetes, hypertension, junk food, high cholesterol, sometimes it is genetic, and chronic vitamin D deficiency, B12 deficiency, chronic prostatitis. These are all the causes of erectile dysfunction. So now what happens? Once you take shockwave therapy and new blood vessels are formed, but if you don't maintain all these things, suppose if you have diabetes and it is not under control, again it can get damaged. If you are hypertensive, or if your cholesterol is very high, if you don't control it, again that can damage the new blood vessels which are formed. Same way, smoking, alcohol, abnormal lifestyle, all these factors can damage the blood vessels. That is why any new blood vessel which is formed in the penis, it may work for 4 to 5 years. After that, slowly even those new blood vessels will get damaged. Then again it can lead to erectile dysfunction. That is the reason, if shockwave therapy works, every 4 to 5 years you have to take one session. So success rate of shockwave therapy in prostatitis, please explain. Okay, definitely I will do a video on this. So one more question, sir. In previous video you said check thyroid, estrogen test, prolactin test for low libido. Sir, TSH, T4, which is best for? See, better to do T3, T4, TSH. Better to do thyroid profile. The two fasting state.